I'm an A&E doctor, and I have been a doctor. I finished medical school in 2013, so 10 years ago, and I'll be a consultant in a year and a half. And
Bravo.
I am looking at jobs in Australia.
Are you really?
I am indeed. So
that's hang on, before you go on. When did you start looking, and why?
I started looking in this last year, and it initially started because I don't know if you've been to A&E recently, but it's horrific. It's like a scene from a movie. It's just awful. Patients being on corridors for ridiculous numbers of hours and feeling like you can't treat people the way you want to, and just this isn't what I went into medicine for. So that's what initially started me looking, and then feeling like there's no one listening. The government's not listening. It's never going to change. And now the strikes as well. Yeah, I think everyone's morale is ridiculously low. And I'm not the only person that I know that's looking. One of my colleague consultants has just got a job in the UAE. He's going. One of them is retiring in his 50s, early 50s. And he's just said, I'll do anything else.
Wow.
And I know 2 registrars who are going to Australia, and I know 2 that have already left. So I don't know what they're talking about when they say not many people have been going. Maybe those are statistics, but in my experience, lots of people are going.
And Liv, tell me, what's the process here? I mean, do you kind of go on the internet and do you find out, how you get hired in Australia, or do they come to you in some cases? We've heard all these reports of, the Australian government sending recruitment, circuses to the UK to hire doctors. Have you seen that? Have you heard about
Australia.
it?
And not just Australia. I mean, I've got on all my feeds and my emails, everything, like Canada. I've got emails from recruitment from Nova Scotia, from New Zealand. You can go anywhere.
The world wants you, Liv.
It's easy. You can just look on. I don't want to go. I've got 2 young children.
Yeah.
My family are all here. I've never been someone to think, I'm going to go to sunnier climes. I wanted to stay in the UK, but it's just untenable. My mental health can't take it. We don't treat our patients well. The money's not coming into the NHS where it should be. It's not something I'm willing to continue doing to myself and to my family.
But what you're saying also, if I hear you correctly, is that this is not an easy decision because your life is here, or your family is here, your parents are here, and so on.
Yeah, exactly. But with regards to this minimum training that people are talking about making people do in the NHS, like it's some kind of fix, it's not. If you decide, I want to make you work 5 years in the NHS after you've finished your medical degree, that's fine. I mean, I've done 10. So you're not going to stop me leaving. And everyone that I've told you that I know that's leaving has done the minimum 5 years. One of the natural transition points where you could move abroad is at the registrar point of an ST3. That means you've done a minimum of 5 years in the NHS by the time you reach that point. So you've done your foundation years 1 and 2, and then you've done ST1, 2, 3. You're now a registrar. That's the point at which people start to look. So if you say 5 years in the NHS, that's fine. They're good. They're just going to leave then.
I mean, the other thing is that I guess, the argument about, the country has paid for you to become a doctor. How can you desert them? Actually, you've paid largely for yourself to become a doctor because of the student fees.
Yeah, which I'm still paying back 10 years on. And also I feel like I've paid for them in the nights and
You've done your porridge.
I've put some sweat into this game. And I really, really care. And that's why I started looking abroad, is because you come home at the end of a shift and you think about some of the people that you've seen that day and you just feel miserable because... So I'll give you an example. There was a man recently that I ended up treating who had end-stage bowel cancer, and he was in A&E. And at the time I came in the morning, he'd been sitting in a chair for 8 hours. And what had happened was his bladder had created a hole towards his bowel just because of where the tumour was. So the reason he'd come in was because he had an infection and he was leaking urine out of his back passage. And he was sitting upright in a chair in the waiting room for 8 hours. This was the last day of his life. He died 12 hours later.
Oh, that's awful.
So this is the kind of thing that you come home and you sit down and you think, this is my foreseeable future. I'm going to be doing this every day. And I didn't really help that man. There was nothing I could do. to make it any better for him because we didn't have the resource. So what's the point in me just going in day after day after day if no one's going to change anything?
And when you hear this government plan, in all its ambition, do you think good on you or this is not going to work?
It's not going to work. I mean, you're talking about creating extra people coming in, but you're talking about junior staff coming in. So from an A&E perspective, even if you talk about bringing in a load of apprentices, they all have to feed back through the senior doctors. You can't have an apprentice see a patient in A&E and discharge them without feeding back that entire history, examination and everything to a senior doctor. And to be honest, they're probably going to go re-see them anyway at the end of that to make sure that what you've told them is correct.
Sure.
But it's the only safe way to do it. So if you gave me 20 apprentices at night on a night shift, it's not going to help me. I'm the slowing down factor. I am your bottle stop. And there's only one of me. So,
well, I wish there could be more of you, Liv. It was a pleasure talking to you. And I wish you all the best. And keep in touch with the programme. I'd love to hear whether you actually end up in Australia or not. And when you get there, how much better it is or not. Let's hear from that. Liv in the Wirral, thank you so much. Let's go to Amon in Cambridge. Amon, you're on the air.
Yeah, hi. Thank you for having me. I'm really sorry to hear about your past caller's experience, and particularly about that patient who died in such tragic circumstances. So I'm a consultant surgeon. I've been a consultant surgeon since 2007. And I wanted to start off by saying that I am absolutely delighted that the government is making this move. I feel that we do need to do something radical. It will take time, clearly, and it's going to start off with junior people. But the people in this country, our patients, our population, deserve to have a properly staffed NHS. That's hugely important. And let me just start off by saying the fact that these people are going to come in and have more clinical exposure from the beginning, to me, is a great step forward. I've seen medical education change from my time. I qualified in 1991 from Guy's and St Thomas's Hospital in London, and I have seen how medical education has been taken over by too much theory, getting people away from the wards, not building up clinical experience. And even as very junior people, we were learning, but we were also part of the team.
So you've got to learn on the coalface, basically.
You've got to learn on the coalface, and the sooner you start doing that, the better. And I also agree that medical school can be taught. Medical education to train a doctor can be taught in less than the 5 to 6 years it takes, and taught extremely well. So this will translate to more doctors coming through, more nurses coming through, and it'll translate to more people around. And as your other caller said, the decision-making, the final decision-making has to be at a more senior level, that those people will come through. So I'm optimistic, and we can't. I understand, completely understand. I have a daughter who's a medical student. I understand why people might want to go away. But the people here still need us, and we have to find ways of keeping people. If we can't grow our own population, yes, people can come from overseas, and they're absolutely talented. They're fantastic. My parents came from overseas. I was born overseas and came here as a 2-year-old child. But we have to have homegrown people supporting and working in these services. So that's my starting point.